Hi, this is our lab values assignment. Our group was myself, Lauryl, Jordyn, Megan, Mary, and Maddie. So, our first case study, this individual has Hashimoto's and lupus. Some comorbidities with these conditions are chronic fatigue, hyponatremia, which is low sodium, and joint pain and stiffness. This person requires moderate assistance with showering due to decreased endurance and activity tolerance. Moderate verbal cues are required to sustain attention and sequence tasks due to fatigue and slowed cognition, and moderate assistance for brushing teeth due to joint pain, which limits their ability to do fine motor tasks and perform self-care activities. The abnormal lab values for this person, their electrolyte panel showed a sodium level of 127, and their regularly scheduled thyroid function test for maintenance of their Hashimoto's showed a TSH level of 0.1. So, okay, some risks to be aware of with this patient would be the hyponatremia, that there's an increased risk of confusion, dizziness, headache, muscle weakness, and falls, which also just impacts the safety component, and needing to keep the person safe. The low TSH, there can be lethargy, slowed cognition, poor thermoregulation, and decreased alertness. And the functional risks here would be the increased risk of falls, which I already mentioned, and dependence for ADLs. So the clinical reasoning process for the intervention that I thought was best for this patient was due to the client's fatigue, the slowed cognition, and reduced endurance associated with the hypothyroidism, as well as safety risk related to hyponatremia, such as dizziness, confusion, and fall risk. The OT should closely monitor the signs and symptoms as well as activity tolerance throughout the session. The client's joint pain and stiffness from lupus further restrict participation in fine motor and self-care activities, which requires task adaptation. And the OT should prioritize interventions that promote energy conservation, safety, and task efficiency while avoiding overexertion that could make their symptoms worse. And also being mindful that the client needs rest breaks, being aware of the environment and setting them up for success there, and encouraging healthy habits and routines, such as staying hydrated and the temperature sensitivity component, that can just make symptoms worse. So the most appropriate intervention is activity modification and task adaptation for ADL performance, providing the client with those energy conservation and joint protection strategies. And that will also include education on symptom management. So the implementation of this intervention would be the OT guiding the client through portions of their morning self-care routine, ADLs such as grooming, dressing, oral hygiene, maybe the showering component, while also teaching and applying the following strategies. So the first one, the 4 Ps, prioritize, plan, pace, position. So prioritizing which tasks are the most essential first. So that way they have enough energy for those tasks that are absolutely needed. Planning, so that would include setting up your space before, just not having to go back and forth for supplies constantly. That's unnecessary. And then pacing, so taking those rest breaks, working slowly, and positioning so they can sit for a grooming task to help the fatigue. And then joint protection, so using built-up handles or adaptive tools if needed. And then the environmental safety component, which is just making sure there's not clutter everywhere and the seating is stable, grab bars if they need it. And the last thing that I would educate them on is the symptom awareness. So just helping them recognize the early signs of hyponatremia and how that can actually become very severe very quickly, and how to respond to that, and also telling them to let someone know whenever they are having these symptoms so that way they can get help. And also, to support carryover, the OT can collaborate with the client to develop a structured morning routine, incorporating all the strategies that they were just educated on.
Okay, guys, I'm Mary. The next case is the patient has diabetes and kidney failure. So, with that comes hypertension, neuropathy, retinopathy, kidney damage, and fatigue. Their functional levels, they are meniscus during showering because of that fatigue, and then moderate assist for shaving and brushing their teeth due to decreased sensation and neuropathy. Their current lab values, the patient runs a 6, and for the purpose of this case, they are male. Um, and so that is very much above what the normal range is. And then their magnesium level is zero point 0.3, which is much lower than the average value. So risk, because of the high serum, they are at risk of fluid retention that can cause edema and shortness of breath. And then their low magnesium levels causes muscle cramps, tremors, decreased coordination and endurance, as well as fatigue. So with their daily function, they can overexert themselves in ADLs and then causing them to not be able to participate in any other occupations. And then decreased sensitivity of extremities, which also puts the patient in danger of falling, and then decreased skin integrity, which puts the patient at risk of infection. So, clinical reasoning. So, because of all of these comorbidities and symptoms that they have, because of um, their high and low lab values, the OTs need to focus on activity tolerance and not overexerting the patients, as well as looking at signs of fatigue and emphasizing that fall prevention and skin integrity. So, the most important intervention that's most appropriate is energy conservation and activity modification. So, this looks like setting up the environment, which is just placing a chair in the bathroom, whether that's next to the sink or in the shower, just so then they're able to take as many breaks as they need to. And there's that visual cue of the chair of like, oh, I need to take a break. And then demonstrating to the patient energy conservation. So that just looks like emphasizing those high energy tasks first and the most important task first, and then pacing themselves within those tasks, as well as during the breaks, encouraging deep breathing. And then using adaptive techniques and equipment, so those built up handles, grab bars, electric razors, and then monitor for fatigue. So looking at the shortness of breath, muscle tremors, weakness, dizziness, and edema.
Okay, hi, I'm Jordyn, and my case study is rhabdomyolysis and metabolic acidosis. So, that is the diagnosis for this individual. He is a man, a middle aged man, and he also has comorbidities of compartment syndrome due to a crush injury. So, rhabdomyolysis is just the breakdown and kind of death of those muscle cells, which can lead to metabolic acidosis, and then the increased swelling and creatine kinase levels, myoglobin levels, and electrolyte levels that are emitted from the muscle due to the muscle breakdown and damage can lead to increased swelling. And in that lower leg, we have that thick fascia, which can lead to a lot of pressure and compartment syndrome, which happened here. So the functional level of this individual is max assist during weight bearing and transfers due to pain and swelling of the right low extremity and impaired endurance. Rhabdomyolysis also usually causes a lot of fatigue, so that is why there is impaired endurance there. Max assist during showering and max assist during lower extremity dressing. So the current lab values, the current skeletal muscle creatine kinase levels is 4,500, and normal is usually between 38 to 147. Anything over about 4,000 for creatine kinase can usually indicate rhabdomyolysis and acute kidney infection. And then the anion gap is currently at 20 with the potassium used, where normal is usually 16 or -4. So some risks associated, as I just said, any creatine kinase level over 4,000 can indicate severe muscle injury that suggests moderate to severe formation of rhabdomyolysis, which can also lead to acute kidney infection or renal dysfunction. And then compartment syndrome, just the like swelling and damage to the tissue can lead to that swelling, and it's kind of an ongoing cycle of the crush injury causing pain and swelling, putting pressure on the compartment, causing an increased release of more creatine kinase, myoglobin, and electrolytes that were already being released. Um, and then that just being an ongoing cycle, causing it to increase all of these levels and possibly lead to renal or kidney infection. And then rhabdomyolysis, as I said, acute kidney infection, metabolic acidosis, shock, and multi organ failure. So, for this individual, my clinical reasoning is due to pain, swelling, and reduced endurance, loss of range of motion. The OT will be mindful of activity tolerance, pain control, and prevention of secondary impairments such as nerve damage, infection, and acute kidney injury. One intervention that I think would be most appropriate for this client would be energy conservation and pain and activity tolerance. So, metabolic acidosis and rhabdomyolysis both make the patient susceptible to overexertion, fatigue, and weakness. So, it's important to do some of that activity pacing, making sure that they're able to endure the things that they need to do during their day. So, for my intervention, I would do a showering task. So, I would set up the environment to provide an extended tub bench to allow for an easy max assist transfer into the shower. Make sure there's non-slip mats, grab bars, long-handled sponges, and a handheld shower head to make bathing easier, to where they're not having to bend over or move their body a lot to wash their body, to make sure they're not getting fatigued. I would also do short breaks between, like breaking down the tasks, taking breaks as needed to increase their energy. I would place a short stool under their right lower extremity to prop it up to decrease that pain and swelling while they're showering, and then set up bathing materials within arm's reach so they're not having to move a lot again to reduce fatigue. I would also educate the patient through a shower routine using activity pacing, taking breaks between the different body regions, and using proper bathing techniques with the assistive devices like the long-handled sponges and the handheld shower head. And we would dry off using an absorbent robe while seated, and using colder temperature water the whole time we are showering, just to help reduce that fatigue. Thank you.
Okay, so going into the next case study, this is on cirrhosis. Some typical other diagnoses that can follow with cirrhosis would be like type 2 diabetes, hypertension, malnutrition, hyperlipidemia. For somebody with cirrhosis, their functional levels might look a little bit different. So using moderate assistance during dressing, as they're likely to have weakness and a decreased tolerance to activity due to fatigue. Also, minimal assistance during bathing due to increased fatigue and fall risk to edema. For our lab values, some abnormal lab values for somebody with cirrhosis might look like less than 35 milligrams of HDL, whereas the normal for a male is above 45 and above 50, not 55 for a female. Also with serum albumin, less than 1.5 would be a critical value, whereas the normal range is usually between 3.5 and 5. Some risks to be aware of with functional levels and lab values. Lower levels of serum albumin usually lead to a higher risk for edema and fluid buildup in
the legs, as well as impaired wound healing and catching of the skin, and it can cause wounds to heal slower, as well as shortness of breath. Lower levels of HCl typically lead to increased inflammation, fatigue, and a higher risk for cardiovascular disease. Some of these functional deficits might look like decreased mobility, increased fall risk, difficulty with ADLs, such as lower body dressing or showering, decreased attention, and increased confusion, which can usually be due to a toxin buildup since the liver isn't fully cleansing out all the toxins, and overall just an increase in fatigue. Going into more of the clinical reasoning, an increased fatigue and fall risk, the OT will want to be mindful of activity tolerance and monitor for fatigue, weakness, and shortness of breath while performing interventions. Also, a decrease in wound healing is a prominent issue that can come to play with cirrhosis. So, being cautious of pressure sores and looking out for those, as well as during transfers, making sure to have something underneath their body so that way their skin isn't grabbing onto like a sliding board or something. An intervention that would be appropriate for the client would be energy conservation techniques with a task modification. This will allow the client to maintain independence and continue to participate in meaningful tasks and routines while just adapting the task just a little bit and having some conservation techniques that they can use to continue to participate to their full potential. As far as this intervention would go, starting just by determining the status of your patient's symptoms prior to the intervention, educating the client on these energy conservation techniques, such as setting up the environment, activity pacing, using adaptive equipment, taking breaks, breaking things down into parts. And so after kind of just going over the education component, then having the client actually practice this in a therapy setting. So modifying the environment before beginning the task, referring to the previous client education. So just having the client grab needed materials before beginning a task, or bringing a seat near range if needing for a rest, grab necessary adaptive equipment. So an example of this could be if your client enjoys cooking and you are going to run cooking intervention with them, and you want to go over client education on energy conservation. So just grabbing the necessary materials in the kitchen. So like a bowl, a spoon, a knife, flour, sugar, anything else that you need in order to make whatever you guys decide to make. So moving into the next one, have the client engage in the task and use the energy conservation techniques that you have given them from our client education, and provide cueing when necessary. Continue to monitor for fatigue, weakness, shortness of breath, and if you do monitor any of those signs, then maybe take a break. And at the end of the session, debrief regarding the energy conservation techniques, what they found useful, what they do not see using in the future, and the best way to continue intervention in the future in order to keep them as safe and independent as possible.
Okay, so for the next case, this patient had an acute MI and they also have liver disease. Their comorbidities are fatigue, orthostatic hypotension, and type 2 diabetes. Their functional levels right now are mod assistance on all transfers due to the orthostatic hypertension, and they just need a little extra help making sure they don't pass out with that. And then their min assist on showering and grooming due to their fatigue. and then mod assist on medication management for diabetes, and they still need several cues to remember steps. Their current abnormal lab values are their creatine kinase for their MB, which is the heart muscle, is at a 247, which for women, you want it to be below 140. So it's starting to go down because her MI was a little bit ago, so it's not going up anymore. And then the other one is the activated partial thromboplasmin time, which is at 65 seconds, and the normal range is between 30 and 40 seconds. And this is just the rate at which a person bleeds. And so the risks to be aware of for this is the CKMB indicates damage to the heart muscle, so we want to avoid overexertion. And then use a symptom treatment approach. So making sure to watch those and not go too hard on treatments. And then the time increases the risk of bleeding. So anything over 70 seconds puts the client at risk for spontaneous bleeding, and they're already close to that 65 seconds. So you just have to be really careful with them there. So the clinical reasoning behind this one was due to the orthostatic hypotension. The patient is at an increased risk for falls, and the OT needs to be very mindful of the patient's blood pressure during the sessions, because if the patient does have a fall, it could cause a major bleed due to the activated partial thromboplasmin time. So the number one intervention that we wanted to look at for this patient was education on their orthostatic hypertension and their fall risk, and then some task modification. So the first session with this patient would be very simple, just to see where they're at and how they can deal with sitting up at the edge of the bed. So the first thing that I would do is educate the patient on their fall risk before even setting them up, and then monitor their blood pressure throughout, just to ensure that it is safe to sit up without the risk of them passing out, because again, with a fall, it could increase their chance to a major bleed, which would not be good for the patient. And then if they're able to sit at the edge of bed, this can happen in bed as well. We would want to discuss their home environment and different areas that could lead them to falling at home and how this could be modified. Discussing these tasks will help them in their transition back to home. And then we also want to discuss tasks that they do regularly at home. This is also while monitoring their blood pressure to make sure that their orthostatic hypertension doesn't decrease too much. And then we want to find those activities that they do at home normally and ways to modify it that we can trial the next session that they are with us.
For our next case, I'll be presenting on a client with myocarditis, which is inflammation of the heart muscle. And this client is experiencing fatigue, dyspnea, and arrhythmias, which are all common in this condition. Functionally, they require minimal assistance for lower body dressing and mobility because shortness of breath and low endurance make it difficult to move effectively and efficiently. They need moderate assistance during bathing and grooming tasks due to their fatigue and dizziness with exertion. And then looking at their lab values, we see several abnormalities. Their tropin I is 1.2 nanograms per milliliter, with a normal value being less than 0.04. So that's a significant elevation that indicates heart muscle damage, meaning that the client is at risk for arrhythmias or even cardiac arrest with too much exertion. And the white blood count is 15,000 per microliter, and this is above the normal range of 4,000 to 11,000. And this suggests that inflammatory or infectious process. And then for the C-reactive protein, it's 25 milligrams per liter, and this is also elevated from a normal of less than 10, which further confirms ongoing inflammation. So functionally, these lab results tell us that overexertion during ADLs could cause chest pain, dizziness, or shortness of breath, and the client's fatigue also increases their fall risk and limits their overall daily participation. And now, so from a clinical reasoning standpoint, the OT's main priority is to keep the client safe while promoting independence.
During each session, I would monitor their heart rate, blood pressure, and oxygen saturation to make sure that the client was staying within safe ranges. And because of their cardiac inflammation, we would want to avoid high intensity activities and allow frequent rest breaks. And if the client experiences chest pain, dizziness, or shortness of breath, the activity could be stopped right away. And our overall focus is on safety and energy conservation to support cardiac function and reduce that fatigue. The most appropriate intervention for this client is energy conservation and activity modification training. To implement this, I would educate the client on pacing techniques, which could include sitting during their ADLs, resting between tasks, and organizing materials before starting. Another one would be practicing grooming or dressing using energy saving strategies so they could complete these tasks more efficiently. And we can monitor their vital signs and perceived exertion during these activities to make sure that their heart and oxygen levels remain stable. And finally, teach early warning signs of overexertion. This might be chest tightness, lightheadedness, or unusual fatigue, along with safe ways to rest and recover. So, overall, the goal is to help the client stay as independent as possible while protecting their heart and preventing complications. Okay, thank you, and that's all that we have.